The abrupt dismissal of Susan Monarez, the former director of the Centers for Disease Control and Prevention, CDC, has sparked intense debate and raised serious questions about the influence shaping public health policy. Monarez appeared before the Senate Committee on Health, Education, Labor and Pensions in Washington, D.C., where she openly stated that her removal last month was directly linked to her refusal to comply with demands from Health Secretary Robert F. Kennedy Jr. Specifically, Kennedy pressured her to pre-approve vaccine recommendations before they were made public, and to fire career scientists whose work did not align with his agenda. But here's where it gets controversial. Monarez maintains that she stood firm because she believed vaccine policies must be driven purely by scientific evidence, not political ideology. During her testimony, Monarez challenged Secretary Kennedy's version of events, which had been publicized in a recent Wall Street Journal op-ed and reiterated at a congressional hearing. Kennedy claimed she was dismissed because she was considered untrustworthy, a serious accusation Monarez categorically denied. Instead, she recounted a series of confrontations that culminated in her firing, including a particularly tense meeting in late August. In that session, Kennedy reportedly told her that the childhood vaccine schedule would change starting in September and insisted that she needed to support this shift, regardless of concerns. An interesting dimension to this testimony came from Senator Bill Cassidy, a Republican physician and chair of the committee, who played a key role in Monarez's Senate confirmation. He reminded the committee that Monarez was not only the first CDC director ever confirmed by the Senate, but also received unanimous backing from his own party. Kennedy himself had previously praised her, calling her scientific credentials unimpeachable during her swearing-in ceremony. Senator Cassidy pressed the panel with vital questions. What went wrong? Did we fail in oversight? Were critical steps missed? The American public deserves transparency and full disclosure, not a narrative tailored to convenience or agenda. Adding further weight to these claims, Dr. Deb Howry, the CDC's former chief medical officer, also testified. Howry, along with other senior agency officials, resigned in late August to protest the drastic leadership shifts and policy changes sweeping through the CDC. This hearing arrives just before a pivotal vaccine advisory committee meeting scheduled for Thursday in Atlanta. Notably, Kennedy fired the entire 17-member Advisory Committee on Immunization Practices, ACIP, in June, and replaced many members with individuals known for their vaccine skepticism. This move has fueled mounting concerns about the direction in which vaccine policy is headed. Monarez also recounted a distressing event following the August 8 shooting at CDC headquarters in Atlanta. Kennedy ordered her to return immediately to Washington, D.C., a command that would have caused her to miss the memorial service for the fallen officer. A gesture she refused, highlighting the human cost amid political turmoil. When the two finally met on August 25, Kennedy allegedly demanded she give blanket pre-approval to the vaccine panel's forthcoming recommendations, and threatened her dismissal if she did not comply. According to Monarez, Kennedy informed her that he had already been in talks with the White House about removing her, suggesting high-level backing for this drastic intervention. This unfolding story shines a spotlight on the complex interplay between science, politics, and public trust in health institutions. Is this a necessary shakeup to align CDC policies with evolving priorities, or a dangerous politicization undermining scientific integrity? What do you think? Feel free to weigh in and share your perspective. After all, vaccine policy impacts us all. Stay tuned as this investigation continues and new testimonies emerge.